Assalamu alaikum. My name is Fatma Kashif, roll number BP1650067. This assignment is submitted to Madam Shahana, and my topic is the bleomycin. That what is bleomycin? Before going towards the case study, we will discuss that what is bleomycin, what are the mechanism, indications, adverse effect, irrational use, rational use, dosage form, doses, etc. So what are the bleomycin? Basically, the bleomycin is a glycopeptide that used to inhibit the DNA synthesis, and they can occur basically in the G2 phase. They basically cause the cessation of the DNA by an oxidative process. Bleomycin is a cell specific and cause the cell to accumulate in the G2 phase. Means that they are the cycle specific and they can accumulate only in the G2 phase and inhibit the DNA synthesis. So what are the primary use? Primarily it is used in the Hodgkin lymphoma as well as in the testicular cancers. Now how it inhibits the DNA synthesis, we have to know its mechanism. As what is mechanism? The bleomycin is a mixture of the glycopeptides that it provides the free radicals, and these free radicals bind to the DNA, and when these free radicals bind to the DNA, it causes strand breaks and inhibit the DNA synthesis. Now, what are the indications? Bleomycin is basically used in the drug regimen and used for the treatment of the cancers, such as it's an important component of the drug regimens for the Hodgkin lymphoma, testicular cancer. It can also be used for the various lymphomas and also for the squamous cell carcinoma and in some other treatments. Now, what are the rational uses? As I discussed, that bleomycin has approval for the adult use treatment for the squamous cell cancer of the head and the neck region, as well as the Hodgkin lymphoma and the testicular carcinoma. It can also be used as a sclerosing agent for the malignant pleural effusions. By the use and by the treatment, as we know that there are several adverse effects. And what are the adverse effects caused due to the bleomycin? That they can cause that they have a toxicity profile that bleomycin cause the pulmonary dysfunctions, which slowly develop and it's dose limiting. It can also give the adverse effects such as the hypersensitivity reactions, due to which there's a chill, fevers, and the anaplexia are common. Some other adverse effects are also there, which are called such as the blister formation and some other. Now, what are the irrational use? Always remember that irrational use of drug always leads to the negative consequences. Now, what happened? That patient not get the proper treatment, unnecessary prescriptions of the drug, all these come under the heading of the irrational use, development of the resistance to the chemotherapeutic agent, adverse effects of the drug. All these can also lead toward the economic burden on both patients as well as hospitals. Now, what are the doses and the dosage forms and the strength for the bleomycins? Powder for injections of the bleomycins available in 15 units as well as the 30 units. There are the different strength and the dosage. Dosage form is basically the injection form, and what are the different strengths used for the different cancers. For example, for the squamous cell carcinoma, 0.25 to 0.5 unit per kg is given. It's given by the intravenous, intramuscular, or subcutaneous into 1 to 2 weeks. In the Hodgkin disease or the non-Hodgkin lymphoma, 0.25 to 0.5 unit per kg is given, and it is also given as the IV, IM, or the subcutaneous for the 1 to 2 weeks. We can reduce to the maintenance dose of 1 unit per day or 5 units per week, IM or IV, after if there's a 50% response in Hodgkin lymphoma treatment by the bleomycin. In testicular carcinoma, we use the 0.25 to 0.5 unit per kg, and it is also given as the IV, IM, or subcutaneous 1 to 2 weeks. Now, as we learned that there are the 3 routes for the bleomycin. So what are the routes? Intravenous, subcutaneous, intramuscular routes are available for the bleomycins. As there is the dose adjustment for the renal impairment patients, we have to adjust the dose if there is creatinine clearance is below 50. So what we have to do, if creatinine clearance is greater than the 50 ml per minute, then it's okay. We don't require dose adjustment. But if it is between 40 to 50 ml per minute, then we require 70% of the normal dose. It is in 30 to 40 ml per minute, 60% of the normal dose. As creatine clearance is 20 to 30 ml per minute, we need 55% of the normal dose. If creatine clearance is 10 to 20 ml per minute, 45% of the normal dose. And if the creatine clearance is 5 to 10 ml per minute, then we have 40% of the normal dose. In pregnant and the lactation women, what we have, it's a category D drug, and in lactation, it is not known whether the drug is excreted in milk or not. So it is recommended that the nursing be discontinued by women receiving the bleomycin therapy. If there's a toxicity adverse effect, or in some case we have to drop the bleomycin, so what are the alternative choices? What the choices we have to give into the patient? There are the several alternative choices such as adriamycin, dicarbazine, deoxyzimab, vedotin. There are the several choices we have to use in the case of the bleomycin is not using or it's producing adverse effect. Now, what is antidote? If some drug is overused or overdose is given to the patient, there's a conditions, its lethal condition is occur. So we have to give the antidote. For the bleomycin, there is no specific antidote is available for the overdose. So what we have to do, treatment should be symptomatic and supportive only. In the event of the respiratory, if there is a respiratory complications, we should give treatment with the corticosteroids beneficial, and it can also be administered with the broad spectrum of the antibiotics. It is also advisable. Bleomycin have no proper or specific antidote. There are several drugs that have the interaction with the bleomycin: phenothiazine, cisplatin, leflunomide, azathioprine, etc. Now, what we have, there are the Biomycin brands available in Pakistan with the economic rate, but there's no such difference in the prices of these all three. We have Biomycin, Bleosip, and the Bleomycin. All three manufacturers are different. Biomycin manufacturer is Acto Laboratories, and in the injection form, Bleosip is AG Mirza Pharma. It's also in the injection form, and the Bleomycin is the S Ijazuddin company. It's also the injection form. So what we have the economic wise, we have all these in the same range. There's a straight price is between the 850 to 1000 or 990, and the retail price is from 1000 to 1100. Now, as we all know that what is the bleomycin? It's a glycopeptide. It inhibits the DNA. What are the rational uses? It is used for the Hodgkin lymphoma, testicular carcinomas, testicular cancers, or the carcinomas, different. There are some adverse effects, irrational use, what has occurred, there's no antidote, all these things we have learned. Now, there's a case. We have a 24-year-old man who presented with a complaint of swelling in the right side of the neck and cuff with a mucoid expectoration, was diagnosed to have a Hodgkin lymphoma, a stage 2B, and was started on 6 cycles of the ABVD, adriamycin, bleomycin, vincristine, and dicarbazine regimen, followed by the involved field radiotherapy. Patient was in complete remission post radiotherapy and was kept under regular follow-up. After 10 years, he again presented with the right angular lymphodopy, and biopsy was suggestive of Hodgkin lymphoma. Staging evolution showed involvement of the bone marrow, and hence was diagnosed as having relapsed Hodgkin lymphoma stage 4A. He was started on COPP and ABV regimen, cyclophosphamide, oncovin, prednisone, procarbazine, adriamycin, bleomycin, and vinblastine, with the dose of the offending drug bleomycin being 15 IU in 100 ml, 0.9% normal slides. 2 weeks after the last chemotherapy cycle 4, patient presented with the complaint of the breathlessness on exertion, which was in the insidious and progressive, and hence was admitted in the intensive care unit, ICU. So, what is the case study? It is the case study of the Hodgkin lymphoma. Patient had the Hodgkin lymphoma stage 2B. At the time, it gave with the regimen ABVD, and he was fine. Its follow-up was regular follow-up was capped, but after 10 years, they presented with the right angular lymphadenopathy. Now, what suggested? We have suggested the biopsy for the Hodgkin lymphoma, and at this time, there was a relapsed Hodgkin lymphoma at stage 4A. So what we have to do, we have to give the regimen. We put the patient on the COPP and the ABV regimen, but After the 2 weeks, last chemotherapy cycle 4, what happened with patient was complained with of the breathlessness, due to which she was shifted to the intensive care unit. Now, what we have to do? Either we have to stop the regimen completely, or we have to give the alternative choice, and we have to find that what is the reason of this complication. So, there's SWOT notes, subjective. Why we know as the patient's age is 24 and it's old man. Okay. And now the chief complaint was relapsed Hodgkin lymphoma. We have treated the Hodgkin lymphoma. After 10 years, there's a complaint of the Hodgkin lymphoma. And what was the history? As we learned that history was that was swelling in the right side of the neck and cup with the mucus expectoration was dicon. At that time, it was as a stage 2B. Now it is at a stage 4A. And what is the complaint? It's compared the breathlessness on excursion, and it shifted to the intensive care unit after the 2 weeks of this cycle 4. Right now, what we have to do now? We perform the high resolution computed tomography. Correct. Showed what this shows, that it shows there is a saturation, there is an impression on the impression which causes the lung disease. Now, what we assessed? We assessed that he was diagnosed with the Hodgkin lymphoma stage 2B. It was the previous approach. What we find that what was the regular follow-up was given. But now what we are doing that we are providing the chemo, which was we are providing the regimens with cyclophosphamide, oncovin, fidnosin, procarbazine, adriamycin, bleomycin, vinblastine, and the doses was giving. All these was performing fine. After 2 weeks, patient complained with the breathlessness. Above presentation and the computed tomography finding shows that drop in saturation patient was started on non-invasive ventilation, steroids, and the acyclovir. We started this treatment. Now all this was happening, but now what is our plan? What is the treatment we are going to do to the patients? For the Hodgkin lymphoma chemotherapy sensitive disease, it is an administered a full dose given on schedule is critical. We can't skip the dose. We can't change the day. We have to schedule, because schedule is very critical in the chemo. Now, cycles of the ADB, as we know, is given for the 28 days, which was given previously to the patients. Always fine. That what we as we know that the bleomycin is responsible for the pulmonary bleomycin induces a lung injury, and the patient should be monitored for the pulmonary symptoms or the abnormal pulmonary function test or the X-ray of the chest. If this occurs, this means bleomycin should be discontinued from the further treatment. After on invasive ventilation, steroids, and the acyclovir, patient responded to the treatment. As patient responded to the treatment, we stopped the ventilation. We went to the ventilation, and after 1 month, and steroids were stopped after the 6 weeks, because patient was responding. And subsequently, what we have to do, we have to stop the bleomycin. We planned that we are going to stop the bleomycin at this time, because bleomycin was responsible for the side effect. So we have to remove the bleomycin and continue with the COPP and AD regimen, and on repeating the computed chromatography scan, there was a regression and resolution of pulmonary fibrosis. We have to drop the bleomycin, but we have to continue the computed tomography for the regular follow-up. What is going on, if there is complication is occurring or not. In this diagram, I have shown you that there are the different stages. We know that the patient before 10 years were at the stage 2. Now, but now the patient is on the stage 4. So we have to drop the bleomycin and continue the regimen. We can't stop the chemo right now. There are the different regimen doses, modes, and day as given in this charts as A, B, DV, adriamycin, bleomycin, vinblastine, dicarbazine. What are the different doses? What are the modes and how many days? That's 1 to 15 days and 2 cycles given for 28 days. Then we have COPP, cyclophosphamide, oncovin, procarbazine, prednisone, and the different doses are available, different modes are available, and same different days are available. We have to follow the schedule very carefully, and we can't skip the dose. We can't skip the dose. In a single dose, we can't change the days, right? So This was the case, and what we planned and what we suggested, as we all know, that we have to stop and discontinue the bleomycin because the complication was basically due to the use of the bleomycin. Before 10 years, the bleomycin was working properly, but now there was a complication occurring. All these materials I have taken from the different books, different websites. All the references are given. I have taken all these from the Lippincott, Kadzin, NCBI website, druginformationsystem.com, Journal of Cancer Research article, National Center of Biotechnology Information, drugs.com, Medscape. Thank you. Allah Hafiz.